Hello everyone, a very good morning to all of you. So today we are going to discuss an ultra important topic. Either that topic that you can say it's belong to microbiology or it's common in pathology also. So I am going to discuss the important, small but yet complicated topic, that is complement system. So I will super simplify this topic for you. Right. Now, this topic is common in microbiology as well as in pathology. In both the syllabus, we read the complement system and we will cover with both aspects. And not only from a university exam point of view, we will cover it from competitive exam point of view also. So any MCQ coming from this topic, you will be able to solve that. So let me start. Can we start it? So let's start with the complement system. So I guess you can see my screen. So let's start with complement system. Okay, so first of all, I would like to tell you what is complement system in the introduction. What do you mean by that? Many students even don't know what does it mean. Okay, then I will tell you the various components, then the biosynthesis of the various components. The ultra important thing is the 3 pathways I am going to discuss with super simplicity. You can't imagine. In the end, we will see the functions of the system and the diseases due to deficiency of any of the component. So let's start it without wasting any further time. Okay, can I start? Give me a thumbs up. Can we start? So let's start the complement system. What is complement system? So in all mammals, not only in humans also, and including all the mammals, in the blood vessel, there is a system of 9 protein which is known as C1 to C9. This is complement system. There are nine proteins, C1 to C9. Now C1 is further divided into 3. C1Q, C1R and C1S. So if you include the further 3 components of the C1, so total will be 11. Although it's 9, you can see C1 to C9, but C1 is further split into 3 parts. C1Q, C1R and C1S. So total there are 11 components, you can say. They are present in the blood vessels of human. Okay, in the serum of the human. So they are present in the serum. Why they are known as complement? Why they are known as complement? Because they complement the action of the antibody. Whenever any foreign particle enters human blood, the foreign particle is known as antigen. Okay, whenever any antigen or any foreign particle enters the human serum, human blood, the complement system get activated. And this complement system, it is a family of 9 proteins known as C1 to C9. They are non-specific. They are present in all mammals. Okay, and they complement the action of the antibody. Now, please understand it. Okay, so this is complement system. It's a system of non-specific protein. Total, they are 9 in number. They are known as C1 to C9, the complement factors. They get activated when antigen enters in human body. Imagine, listen. Now, this is the serum of a human blood. This is the blood vessel of a human being. Okay, now this is the antigen. You can see the antigen have entered. This is the antigen. Now, antigen cannot activate the complement. No, complement cannot get activated by the antigen. Now, first, because of the antigen, the antibodies will be formed. The antibody will come and bind with the surface of the antigen. So, antigen-antibody complex will be formed. Okay, because of the humoral immunity. Okay, antigen-antibody complex will be formed. Now, this antigen-antibody complex will activate the complement. So, complement get activated neither by antigen alone, no. Neither by antibody alone, no. The complement get activated by antigen-antibody complex. It's a very important question and it's a very important MCQ. Please learn that. Antigen-antibody complex is required to activate the complement. So learn the basics first. Then understanding the systems will be very easy for you. Got it? So antigen-antibody complex activate the complement, not antigen alone, not antibody alone. Please learn this. And this term, the complement, is given by ARID because they complement the action of the antibodies. So this is the introduction. We understood it. Now I told you there are 9 components, C1 to C9. I also told you the C1 get splitted into 3 components, C1Q, C1R, C1S. So total there are 11 if you see. Now in the human blood, they all are present. Now in my blood, in your blood, we all have all. So this is the blood vessel. We have C1 also, we have C2 also, C3 also, till C9 we have everything. So tell me which one is present in the highest concentration in my blood, your blood, which one is in the lowest concentration. So in normal human being, C3 is highest in the blood, in the serum, and C2 is the lowest. So sometime you can get simple questions or MCQs on which of the following is in highest concentration or lowest concentration in human blood. So tell me what we have learned till now. Let's revise and go on the systems. On the 3 pathways, I mean. So what I'm teaching you? I'm teaching you a topic that is complement system. What is complement system? Hota kya hai? What do you mean by complement system? Say, ma'am, complement system is a family. It includes 9 proteins. The name of the 9 protein is C1 to C9, and they all are present in the human serum. And they are non-specific protein. Okay. So my next question to you, how does they get activated? So who is the trigger? So it is activated either by neither by antigen alone, no. It is activated neither by antibody alone, no. It is activated by antigen-antibody complex. So for the classical pathway, the trigger is always the antigen-antibody complex. So in my blood, your blood, they all are present. Okay, they all are present, but they are inactive. Currently, I don't have any infection. Okay, so they are inactive in me. They are inactive in a healthy human. But any human being having any antigen in the blood, because of which the antibodies are formed, and antigen-antibody complexes are formed, then they will get activated. And they will assist the antibody in their function in causing the lysis of the antigen. The ultimate purpose is to remove the antigen from the body. Antibody is trying to do so. Complement is complementing the action of the antibody. That's why they are known as complement. The first thing we have learned that. So this is the introduction, this is the definition, and this is the basis. Okay, now we have understood this. Now total they are 9 now. They are present in my blood, they are present in your blood, every human being. Where does this synthesize in our body? Tell me the organ. So the organs are different. Sometimes you get MCQs. You can get simple MCQs. Where does they get synthesized? So there are total 9, C1 to C9. We will see each of them. Where does they synthesize? C1 synthesized in human intestine. Now say the 2 ka multiple, C2 and C4. Both of them get synthesized in the macrophage. Okay, say 3 ka multiple, C3, C6, C9. 3 ka multiple, they are synthesized in liver. Okay, C1, C7 we unknown. We don't know where does it synthesize. And what is left? C5 and C8. It is synthesized in spleen. How many of you got it? We will try. So tell me C1, tell me C2 and C4. Tell me C3, C6, C9. These are the multiples of 2. These are the multiples of 3. And this is multiple of 1. I mean only 1. So multiple of 1, multiple of 2, multiple of 3. This is how I learn. This is how I learn. C7 we don't know. And what is left? What is left is C5 and C9. C5 and C8. So this is how I learn. Now tell me the organ. So 1 ka multiple is synthesized in intestine. 2 ka multiple is synthesized in macrophage. Okay. 3 ka multiple synthesized in liver. Okay. C7 is unknown. And whatever is left, 5 and 8 is synthesized in spleen. This is how I learned. And you get simple questions. Okay. So let's revise it again. Where does this synthesize? Tell me all 9. C1 to C9. Where does this synthesized? Say, ma'am, 1 ka multiple is C1. 2 ka multiple is C2 and C4. 3 ka multiple is C3, C6, C9. Okay. And 7 is unknown. So what is left? You see. What is left? 2 are left. 5 and 8. First write like this. Now tell me the organ. One organ in which they are synthesized. So 1 ka multiple is synthesized in intestine. 2 ka multiple is synthesized in macrophage. 3 ka multiple is synthesized in liver. है ना? 7 is unknown. And 5 and 8 are synthesized in spleen. You get questions on that. One more question. Let's revise it again. Tell me which one is highest in human blood, which one is lowest in human blood among 1 to 9. So C3 is highest and C2 is lowest. You get questions on that also. We have seen the biosynthesis also. Now, the main portion. The main portion is the 3 pathways. Now, it's very difficult, but I will make a cakewalk for you. Believe me. Just concentrate for the next 10 minutes. In the next 10 minutes, I will discuss the next 3 pathways. Okay. So, there are 3 pathways of complement activation. Okay. One is known as classical pathway. Okay. One is known as Mannose binding pathway, or also known as lectin activating pathway, one and the same thing. And the third one is the alternate pathway. You will say, ma'am, why there are three pathway in human blood? So they are functional in me, you, everyone. But the trigger of the 3 is different. In all 3, C1 to C9 will get activated one by one. I told you C1 to C9 are present in blood. Imagine in my blood, they all are present. But currently they are inactive because I don't have any antigen in my body. Now, depending which antigen is entering in my body, which antigen. So they will the antigen will activate them, but the sequence of activation will be different in the 3 pathways. So there are 3 options. Okay, either they will get activated by classical pathway, or C1 to C9 get activated by alternate pathway, or activated by Mannose binding pathway. Okay, so sequence of activation is different. In classical, the first one get activated is C1. In alternate, the first one get activated is C3. You know, in Mannose binding, it is C4. So, you know, the sequence will be different. We have to understand the sequence. And we have to see the trigger. Which antigen is activating which one. So, there are 3 different options. There are 3 different pathways. First, learn the 3 different pathways ke name. What are the 3 different names? So, first is classical. Second is Mannose binding. Or third is alternative. Okay, first is classical pathway. Classical is most important. 99% we follow classical only. Okay, classical pathway. Second is Mannose binding or lectin activating pathway. The second one, the lectin activating or Mannose pathway. Okay, and the third one is known as alternate pathway. Alternate pathway. So we are having 3 pathways. The first thing we have to understand that. Now we have to understand the trigger in each of them. What is activating, and we in all of them C1 to C9 get activated, but the sequence of activation will be different. So we have to understand that sequence. You get many questions on that, believe me. So one by one we will take them. In all of them, the initiation is different. Hana? So in all of them, the initiation will be different. So this is the complex pathway. You can see all 3, but I will super simplify this diagram. You can see this is classical pathway, this is Mannose binding pathway, this is alternate pathway. You can see how one by one they all are activated. Let's start with the classical. Let's start with the first one, the classical. Can I start classical pathway? Yes. So let's start the classical pathway. Just a second. In the classical pathway, the trigger is not antigen, no, not antibody, no, it's antigen-antibody complex. I told you previously also. So it is the antigen-antibody complex. Just suppose in my blood, any antigen-antibody complex is present. The classical pathway will get activated. In classical pathway, the first complement which get activated is C1. The first complement which get activated is C1. In classical pathway, the first complement which get activated is C1, antigen-antibody complex. How many of you got it? Huh? How many of you got it? Okay, so C1. So please learn, in classical pathway, the trigger is antigen-antibody complex and the first complement which get activated is C1. Okay, C1. Now let me tell you how does it will proceed. C1 leads to activation of C4. C4. Now C4 will split into 2 parts, C4A and C4B. I am interested in C4B, not C4A. C4B will continue the cascade. C4A is not continuing. So first we will start with C1. See the trigger. Please see the trigger. It's antigen-antibody complex. We are talking about the classical. I will discuss all 3. We are talking about, and we will compare all 3 on one page. Okay. First start with classical. In the classical, the trigger is antigen-antibody complex. The trigger in all 3 pathways will be different. Okay. All 3 pathways are functional in me also, you also, but they are inactive. They will get activated by different triggers. So trigger is here in classical, it's antigen-antibody complex. Learn neither antigen alone nor antibody alone. It's antigen-antibody complex, very important MCQ. So the first complement which get activated in classical is C1. C1 से start करते हैं. C1. The next after C1 is C4. Now C4 will split into 2 parts, C4A and C4B. So I am interested in C4B, not C4A. C4B will continue the cascade. What is the next? C4B will activate to next. Next is what? Next is C2. So first was C1, then C4, then C2. You can see here it's C2. C2. The next is C2. Again C2 will get split into 2 portions, C2A and C2B. This time I'm interested in C2A. C2A will continue the cascade, not B. You have to learn that. Okay. So C2A. So basically C4B and C2A bind with each other. bind with each other. C4b from here, and it will activate the next C2a. They will bind and they will make a complex. C4b and C2a, they will make a complex with each other. So C4b, C2a is formed. What's next? Till now 3 are activated. First is C1, then C4, then C2. This is the sequence till now. C1 is C1 only. C4 mein se we took C4b, and C2 mein se we took C2a, and they combine with each other and they make C4b, C2a. They make this. Okay, now this will activate the next. The next is C3. 9. So first was C1, then C4, then C2. Then I will tell you a way to learn the sequence also. Don't worry. First listen. Give me just 5 minutes. Okay. The next is C3. Okay. Again C3 have 2 components. What are the 2 components? C3a and C3b. This time we are interested in C3b, not C3a. So the 3 will bind together. Okay. Which 3? You tell me which 3. From C4, it's C4b. From C2, it's C2a. And from C3, again C3b. Bind the 3 together. Make C4b, 2a, 3b. Say it again. 4b, 2a, 3b. So this is the component form till now. This is the component form till now. You can see 4b, 2a, 3b. This will activate the next. The next is C5 to C9 together. They all will get activated. C5 to C9, and they will cause the lysis of the antigen. The antigen is destroyed. So finally the antigen is destroyed. Say, huh? You can tell me the complete classical. We are done with classical. Who will tell me classical? Huh? Please help me in writing the classical pathway of complement. Then we will discuss the next 2. You have to tell me the sequence. What is the sequence? First, tell me the trigger. What is the trigger? What is the trigger? Bisma, Mitsu, Muhammad. Huh? Anyone can tell me? Ashan, Riaz, anyone can tell me. What is the trigger of classical? Say, ma'am, it's antigen-antibody complex. Always start from here. Antigen-antibody complex. Now tell me the sequence. Say the antigen-antibody complex will activate C1. C1 will activate C4. From C4, I am interested in C4b, not C4a. C4b will continue the pathway, not C4a. C4 will go to C2. C4b is there. It will activate the next C2. Okay, C2 is the next. And it from C2, again we have 2 components, C2a, C2b. So we are interested in 2a, not 2b. So 4b bind with the 2a. The next they will activate is 3, C3. So 4b is already there, 2a is already there. Now it will come 3. From 3, 3a or 3b, I'm interested in 3b. So we have 3 components, 4b, 2a and 3b. Got it? They will go to the next. The next is C5 to C9. They all are there. Now tell me the sequence, how to learn. You will say, ma'am, it look very difficult to me to learn the sequence. It's very easy. Everyone knows 1, 2, 3, 4, I guess. Hai na? 1, 2, 3, 4, 5 to 9. This is how I learn. Okay. What I will do now, listen, I will remove 4 from here and I will put 4 here. This is the sequence of classical. It's as easy as that. Say, ma'am, 1 is C1, followed by C4, followed by C2, followed by C3, and followed by C5 to C9. It's very easy to learn the sequence, people. Very easy. We all know 1, 2, 3, 4. We all know the numbers. Huh? Say 1, 2, 3, 4, 5 to 9. This is how we write the numbers. So just remove 4 from here. Remove it. Remove 4 from here. And where to put? Between 1 and 2. This is the sequence of classical. This is how I learn. And I never forget. How many of you got it? How many of you got it? This is the sequence in the classical. So this is the classical pathway we have completed. How many of you got it? Now let's try again classical. So classical may the first complement get, the first you have to tell me the trigger. Trigger is antigen-antibody complex. After antigen-antibody complex, the first complement get activated is C1. C1 activate C4. From C4, it's C4b, not C4a. Now this C4b will activate C2. From C2, it's C2a, not C2b. And this C4b, C2a activate the next. The next is C3. Again from C3, we have C3b, not C3a. And this will activate 5 to 9. How many of you got it? Give me a thumbs up in the chat box right now. Huh? How many of you got it? Say yes, people. Just a second. Just a second. I can see. Everyone got it? Okay, everyone. Very good, very good. So this is the thing. Now listen. From this, I'm interested in 2 things. Everyone on the screen, listen. From this pathway, you tell me which of the complete pathway. Now you know the classical. You know the complete classical. Okay. Now there are 4 questions which are asked from here. The first thing, they ask the trigger. I guess everyone know the trigger. Everyone know the trigger. Huh? The second thing they ask is the C3 convertase and C5 convertase. C3 convertase. Let me explain you what does it mean. C3 convertase matlab kya? And C5 convertase, matlab kya? What do you mean by that? C3 convertase is a complement complex that will activate the C3. It is the activator of C3. You know, it is going to C3. See, this one, C3. So 4B2A is going to activate C3. That's why we call 4B2A as C3 convertase. Because it is going to convert C3. It is going to activate C3. And what is C5 convertase? Similar way. This one is activating the C5. C5 and followed by C6 to C9. C5 followed by C6 to C9. So 4B2A 3B is C5 convertase. So they ask you what is C3 convertase, what is C5 convertase, and what is the trigger. The fourth question they ask, how many out of C5, C1 to C9? There are total 9 now. Which of them are activated? Which of them are involved? Say ma'am, all are involved. Let me mark. Let me mark all of them. First, where is C1? In classical, I can see this is the C1. Where is C2? I can see this is the C2. Where is C3? This one is the C3. Where is C4? This is C4. C5 to C9. So all of them are involved. All of them. The level of all of them will be reduced. So we are done with classical. We are done with classical. So this is the classical. Rather than learning this is an easy way to learn. So we are done with classical. Hana? So this is the steps of the classical. Now you can elaborate in your own words if you are going to write university exam. If you are going to write university exam second prof, then you have to learn the steps. Otherwise, this one flowchart is enough. But you have to understand the steps now. What is the step? The first thing is C1. Antigen-antibody complex will come that will activate C1. Okay, C1 will activate C4. C4 will split into two parts, C4A, C4B. Now, C4A is anaphylactic toxin not involved. But we are interested in C4B. C4B will continue the cascade. It will go to C2. C2 will split into two parts, C2A, C2B. This time C2B will release in the fluid, in the plasma. We are not interested in that. C2A will continue the cascade and they will bind together, C4B, C2A. And this is C3 convertase. It will go to C3 and it will split the C3 into C3A and C3B. Again, C3A will not continue, it is anaphylactic toxin. C3B will continue and it will be formed like C4B, C2A, C3B, and it is C5 convertase. So we are done with this pathway. Let's come on the second pathway. What is the second pathway? The second pathway here is Mannose-binding lectin pathway. Listen. This is a bacteria. Okay, all bacteria have cell wall. So this is a special bacteria in which the cell wall contains a sugar. The name of this sugar is mannose. It is having a sugar which is having mannose terminal. It's the bacteria. There are few bacteria which is having this sugar in their cell wall. Okay, if imagine this bacteria enters in my body, then classical pathway will not activate it. Then this pathway will activate it. Okay, so here the trigger is different. What is the trigger? Tell me the trigger. See ma'am, the trigger is mannose sugar present in the cell wall of certain bacteria. So if such a bacteria having mannose sugar in their cell wall enters in my blood, then this pathway get activated. Classical will not activate it. In that case, this is. So it is only exceptional case when this bacteria is entering. Otherwise, when any other bacteria or any other antigen enters, antigen-antibody complex is formed. In that case, classical is activated. But when this bacteria containing mannose is entering, it is the second pathway which will get activated. So what is mannose pathway? Let's discuss. Mannose binding lectin activating pathway. Mannose binding lectin. Say ma'am, what is the difference? So see the trigger. See the trigger. Here the trigger was antigen-antibody complex. Here the trigger is mannose sugar in the cell wall of certain bacteria. First see the trigger. First see the trigger. First understand the trigger. Trigger is different. What's the second difference? The second difference here, C1 is absent. Here the first complement was C1. Now you can see the first complement was C1. Here C1 is absent. It's absent. This mannose sugar in the cell wall directly activates C4. That's the only difference. The rest is everything same as that of classical. Rest is everything same as that of classical. They are is equal to. They are same. Rest is everything same except one difference. One difference, in classical C1 is involved. But here C1 is not involved. It's directly C4. So first complement is different. Hana? So here if you see the level of all reduce. All 9 are involved. C1 to C9. Here the level of all is reduced except C1. Here C1 is normal in the blood. C1 is not involved. In mannose binding, C1 is not involved. Because the bacteria directly activates C4. Okay, so tell me mannose binding. Say ma'am, there is a bacteria having mannose sugar in cell wall. This is the trigger. Now, this bacteria is entering in my blood, having mannose in their cell wall. Now, which complement it will activate? Say ma'am, it will directly activate C4, not C1. C4 will split into C4A, C4B. I am interested in C4B, not A. It will go to the next. What is the next? The next is, after C4, it is C2. So C4b is already there. Now it will be C2. From C2, I'm interested in C2a, not C2b. It will go to C3. C4b is already there. 2a is already there. Now it will go to C3. From C3, I'm interested in C3b, not C3a. And it will go to C5 to C9. So this is the sequence. The sequence is same. Everything is same except the C1 is not involved. How many of you got it? How many of you got it? The notes I will provide after the session immediately. Don't worry. After the session immediately, it will be uploaded and you will get it right now. Okay, just understand it now. So how many of you got it? This is the second pathway I told you. So first pathway, we have seen the classical. The second pathway, we have seen the Mannose. And the third, I will teach you now the alternate. Okay, first we will revise the classical and Mannose. Tell me the trigger in both of them. We will revise it once. Okay, what is the trigger here? What is the trigger here? Can you tell me the trigger in both of them? Here the trigger is antigen-antibody complex. Not antigen alone, not antibody alone. But here it is a bacteria which is having mannose as a sugar in their cell wall. So see, the trigger is different. Here only antigen is there. Such a bacteria which is having mannose sugar in their cell wall. Here antigen-antibody complexes are there. Now tell me the sequence. Here say ma'am C1 is there followed by C4. C4 में से C4A नहीं है, C4B है. Now C4B will go to C2. C2B nahi, C2A. And this C4B, C2A will go to C3. C3 में से कौन सा? It's C3B again. Okay, and it will go to C5 to C9. Finally, this is the sequence. You can see this is the sequence in classical. What's the sequence in Mannose? In Mannose, the only difference is that it will directly activate C4, C4B. Without involvement of C1. No, C1 is not there. That is the only difference between the two pathways. C1 is not involved. So this is the bacteria which directly involves C4. C4 में से C4B. The rest is same. See, this step is same. है ना? It will go to C2A. This step is same. It will go to 4B, 2A. It will go to 3, C3B. This step is same. And finally, it will activate C5 to C9. Rest of the steps are same, people. Please appreciate my efforts. Now let me come on the third and the last pathway, alternate pathway. How many of you got it? So classical is done, Mannose is done. You see classical and Mannose में two differences. What are the two differences? Say ma'am, the first thing, trigger is different. You have to understand the trigger. The trigger is different. Here the trigger is this. Here the trigger is this. The first thing, understand the trigger. The first thing. The second difference you have to understand here is that, ma'am, here C1 is involved and here C1 is absent. That is the second difference. That's it. Remaining all are same. So if you see the complement levels here, all 9 are involved. So level of all of them will fall in the blood because they are involved. They are utilized. They are consumed. But here C1 is not consumed. So C1 level in the blood is normal if you check in the serum. But remaining C2 to C9 will fall. Here all will fall. So that is the difference. So in my blood, which one is activated? How to know? You collect my sample. You collect my blood sample in a test tube. You take the serum. In the serum, you see the level of all 9. If all 9 are fall, it means classical is activated in me. If C1 is normal, but remaining all are falling, it means the Mannose binding is activated in me. So that is how we can judge which complement system is activated in a human being right now. Got my point? Can I come on the third one and the last one? So we are done with the first, we are done with the second. So 2 are done till now. The classical pathway is done. The Mannose binding, lectin activating pathway is done. Now coming on the third one, alternate pathway. So it's difficult. Let's start the third and the last pathway, alternate. And on one page, we will compare all 3. Okay, let's come on the alternate pathway. Can we start alternate pathway? Yes, we should. We must. So let's start the alternate pathway. The first thing you should be asking, ma'am, what is the trigger? You told us that for classical, the trigger is antigen-antibody complex. We know that. For Mannose binding or for lectin activating pathway, one and the same thing, the trigger is mannose sugar. Mannose sugar present in the cell wall of certain bacteria. That is the trigger. Now, what is the trigger in alternate pathway? What is the trigger in the third and the alternate pathway? So here the trigger is endotoxin. Some bacteria secrete endotoxin. Endotoxin or the cancer cell is the trigger. Cancer cell. So see the trigger here, see the trigger here, see the trigger here. Trigger is different in all 3. So in human blood, if the endotoxin is present or cancer cell is present, it will activate the alternate pathway. Not classical, not Mannose. It will activate directly alternate pathway. So see the trigger. I repeat again and again, the trigger is important. The trigger will decide the pathway. If the trigger is antigen-antibody complex, it's classical which will activate it and it will continue the cascade. If the trigger is a microbe containing mannose sugar in the cell wall, it will be the Mannose binding pathway that will continue. But if the trigger is endotoxin, or if the trigger is cancer cell, its alternate pathway going to be continued. Now, the next thing you have to tell me, ma'am, what is the sequence here? You know the sequence here? Yes. You know the sequence here? Yes. Now tell me the sequence. Here the first complement was activating C1. In classical, we know the further. Hai. Here it was directly C4 without involvement of C1. Directly C4. Here the first complement is C3. So first complement is different in all three. So here the first complement involved is C3. You get many MCQs from here. And students always get confused. Ma'am, C1, C2, C3. It's very complicated, but it is a fun. If you understand now, it's super simplified. Okay. So here the first complement involved is C3. C3. You will say, okay, ma'am, got it, C3. Now what's next after C3? So either the endotoxin, imagine in my blood, endotoxin is present, or in any human being, the cancer cell is present in the blood. So in the blood vessel, if endotoxin is present or cancer cell is present, it will directly activate C3. Not C1, not C4, not C1 like classical, not C1, C4 like the Mannose binding. It's directly C3. It will activate C3. I got it. Okay, what is the next? After C3, what is the next step? After C3, in the blood, there's a factor known as B, factor B. It is known as factor B. It's a component of the family of the complement. Factor B. It will split into two components, BA and BB. Factor B will split into two components, BA and BB. I am interested in BB. BA will be released in the plasma. It will not continue the cascade. BB will continue. Hana? So C3 from C3. C3 will also split into two components, C3A and C3B. So I'm interested in C3B. C3B, BB will bind together. So I'm drawing again. This is the blood vessel of a human being. In the blood vessel of a human being, the endotoxin is present of some bacteria. Either endotoxin is present or cancer cell is present. Okay. So it will directly activate C3B. C3. C3 ka kaun sa C3? C3B. Hana, it is already present in the blood and that will activate it. Now the next complement will get activated after C3B is factor B. So C3B is already there. It will activate factor B. BA nahi, BB. They will bind together. C3B, BB. They will bind together. C3B and BB. They will bind together. How many of you got it? It's C3B and BB. They will bind together. What's next? What's next? It's again factor 3. It's again. So here we were having factor 3. 3 ka we took BB. Here we have factor B. Again we took BB. Again I am taking the factor 3. Hana, factor 3. And again C3B. So what will form? Say ma'am, C3B is already there. BB is already there. And again C3B. So 3B, BB, 3B. Got it? It's little bit complicated, but not much. If you understood, it's easy. So it's the first trigger is endotoxin or cancer cell. Hana, it is activating C3B. C3B is involving factor B and we have BB. So 3B, BB. And again it is activating factor 3. So 3B, BB, again 3B. 3B, BB, 3B. Got it? And it will activate C5 to C9. The next. So this is the complete pathway we have done. Now you tell me in the third pathway, what is C3 convertase and tell me the C3 and C5 convertase and all of them. What is C3 convertase? What do you mean by C3? C3 convertase is the complex that activates the C3. So you see here C3 is activated, here C3 is activated, here C3 is activated. So who is activating C3? In classical, it's 4B2A. In Mannose binding also it's 4B2A because they are is equal to. Both of them are equal. 4B2A, 4B2A. But here it's 3BBB. So this is the C3 convertase in all three. C3, C3, C3 convertase. Now tell me the C5 convertase in all three. C5. So this is C5. You can see here is the C5. So who is activating C5? In classical, it is 4B2A, 3B. In Mannose, it's 4B2A, C3B. They are equal. They are same. But here it is 3B, BB, BB. I assume, I request you, I advise you to learn only C3 convertase, don't learn the C5 convertase. Because if you want to convert C3 into C5, just add 3B in that. 3B, 3B, 3B. It is already C5 convertase. So don't overstress your mind. So what are the three pathways, people? So we have classical pathway, we have Mannose binding pathway, we'll revise all three. And we have alternate pathway. So who will help me? Who will help me? People come together. We will try together. एक बार साथ में करते हैं. Let's try. So tell me the trigger in all three. Who will tell me the trigger? Say, ma'am, here the trigger is antigen-antibody complex. Here the trigger is the bacteria having mannose as a sugar in the cell wall. And here the trigger is endotoxin or the cancer cell. The first step you learn the trigger. You get many questions on the trigger. Bhai, this is the trigger, this is the trigger, this is the trigger. Which complement system will get activated? The first thing should be clear in your mind. What is the trigger? Which trigger is activating which complement? Okay, now if this is the trigger, tell me the sequence in classical. The first complement is C1. followed by C4. From C4, I am interested in C4b, not C4a. Okay, this C4b will activate C2. From C2, I am interested in C2a, not C2b. And this 4b, 2a will activate the C3. Okay, from 3 again I am interested in C3b, not C3a. So you have to learn the sequence. Okay, and finally it's C5 to C9. C5 to C9. This is the sequence. Now coming on the Mannose one, who will help me in writing the Mannose one? Mannose. So here C1 is absent. It will directly activate C4b. Rest is same. So here also C4b, here also C4b. But it is directly, without involvement of C1. That is the only difference. The remaining steps are same. Here also 4b, 2a. Here also 4b, 2a, 3b. Remaining steps are same. And C5 to C9. Remaining steps are same. Coming on the last one, the alternate pathway. The last one. But here the sequence is different, people. Here the first is C3b. We have directly involvement of C3b. The first thing, we have direct involvement of C3b. The C3b will activate factor B. So 3b will bind with BB. BB, not BA, it's BB. Factor B cannot BA, it's BB. So C3b, BB will bind together. And again it will activate C3b. So 3b, BB, and again 3b. And it will activate 5 to 9. Now let me ask you 5 questions. 5 questions, 5 answers. The 3 complements of 5 into 3, 15 questions in front of you. Everyone on the screen. Let me summarize. So tell me the 3 pathways. The first thing you have to learn the name of the 3 pathways. Students even don't know the name. So it's classical, Mannose, and alternate. First learn the name. After that, the second question. Please everyone concentrate on the screen. I request. If you are not concentrating, you are losing. Okay, listen. Now tell me the trigger in all 3. So here the trigger is antigen-antibody complex. Okay. Here the trigger is bacteria containing mannose as a sugar. Okay. And here the trigger is endotoxin or cancer cell. Okay. Got it. Now tell me the first complement activated in all 3. You get MCQs on that. Tell me the first complement activated in all 3. In classical, the first complement is C1. In Mannose binding, the first complement is C4b. 4b. It's 4 or 4b, whatever you say. In alternate, it's C3. So C1, C4, C3. You get questions on that. Either learn the complete pathway. If you can't learn complete pathway, learn the questions which I'm telling you. Learn the name of all 3. Learn the trigger of all 3. Learn the first complement in all 3. The next question, tell me the convergence of all. Convergence of all is C5. They are combining all together. Here also it's C5, C5, C5. C5 is the convergence point. So this is the next question. Convergence point of all 3 is C5. See the questions I'm marking with highlighter. Learn the name of the 3 pathway. Learn the trigger of the 3 pathway. Learn the first complement of all 3. And learn the convergence. Now the next two questions. Tell me the C3 convertase in all 3. And tell me the C5 convertase in all 3. Let's try with C3 convertase. What is the C3 convertase in all 3? This is the C3 convertase here. It is activating C3. 4b2a. Here also it's 4b2a. They are same. And here it's 3bbbb. This is the C3 convertase. I don't recommend to learn the C5 convertase. Why? See, this is the C5 convertase. This is the C5 convertase. This is the C5 convertase. See. Everyone on the screen, listen. I am saying that in C3 convertase, just add 3b. Just add 3b. It will convert into C5. Add 3b. 4b2a. It's 4b2a 3b. Here also add 3b. Here also add 3. 4b2a. It will be 4b2a 3b. Here it's also add 3b. Here also you do the same. Add 3b. So it's 3bbb. It's 3bbb 3b. So just learn the C3 convertase, people, and add 3b in that. You will get the C5 convertase. But you have to learn it. There are many questions on that. The last question. Finally, the last question. Tell me out of 9, total 9 are there, no? C1 to C9. The level of which will fall in which one? Here all 9 are involved. You can check. C1 to C9. They all are involved. So level of all will fall. You can see C1 is also there, C2 is also there, C3 is also there, C4 is also there, C5 to C9 is also there. All 9 will fall. In the second one, C1 is normal. C1 is not involved. Remaining all, C2 to C9 will fall. You can see C2 to C9 are falling. Yes. What about the third one? What about the alternate one? In alternate, C1 is not at all involved. No, you can check. There is no C1. There is no C2 also. And there is no C4 also. Okay, C1 is not there, C2 is not there, C3 is there, C4 is not there, C3 and C5 to C9 are there. But 1, 2 and 4 are normal and remaining all will fall. So these are the questions you get on the 3 pathways. How many of you got it? So we are done with the 3 pathways and you get the questions. Tell me the trigger of all 3. Okay. Tell me the first complement involved in all 3. Okay. Tell me the convergence of all 3. Okay. tell me the C3 convertase of all three. Okay. Tell me the C5 convertase of all three. Okay. And tell me out of the 9 complement, which will fall here, which will fall here, which will fall here. These are the questions. Now, there are 2 choices. Either learn completely, you can answer all. If you don't want to learn it completely, learn this table and learn the questions. Okay, learn the questions only. How many of you got it? Huh? Tell me the C3 convertase in each pathway. Tell me the C5 convertase in each pathway. I told you C3 convertase you have to learn. Plus 3B, it will be equal to C5 convertase. So don't learn C5 convertase. Learn C3 convertase and add 3B in that. So tell me the 3 pathways, C3 convertase. Huh? So tell me classical ka kya hai? Classical. Tell me classical pathway. Tell me the second one, Mannose binding pathway. And the third one, alternate pathway. Okay. Tell me C3 convertase and all 3. And then C5 convertase we don't learn. We will just add C3. So here it's 4B, 2A. Here also 4B, 2A. Say with me. 4B, 2A. 4B, 2A. Here 3B, BB. What I'm doing now? I'm telling you just add 3B here, add 3B here, and add 3B here. You will get the C5 convertase. Do the addition. Can you do it for me for a while? Do the addition here. It will be 4B, 2A, 3B. Here also the same. Both are same, no? Here also 4B, 2A, 3B. Okay, 4B, 2A, 3B. What about here? It's 3B, BB, 3B. 3B, BB, and 3B. This is how we get it. Okay, G, say yes if you got it. Say yes if you got it. Do you have any confusion? Can we go ahead? Say yes if you all got it. Aage badhe? Can we go ahead? So this is how we learn the 3 complement. Does anyone have any confusion here? So we are done with the 3 complements. Okay. And I told you the questions also. Here is the list of questions. If you don't want to, there are many people, many students who get this complicated. Ma'am, I can't learn all this. Okay, don't worry. You don't learn. Learn this table. Learning this table directly will be difficult for you if you don't understand this. Now, if you have understood this now, learning this table will be fun. And I challenge you, all the questions in your exam will be from this table. Now, this is the 3 pathway, classical, lectin or alternate. Lectin is mannose. Tell me the trigger, antigen-antibody complex, mannose sugar in the cell wall, endotoxin and cancer cell. Tell me the first complement. Here it's C1, C4, C3. You can see C1, C4, C3. Learn the first complement. Okay. Tell me the C3 convertase. You know that. Tell me the C5 convertase. You know that. And tell me the level of the complement. Here all 9 will fall. Here C1 is normal. Remaining all will fall. Here C1, C2 and C4 is normal. Remaining all will fall. This is how we complete it and we understand it. Okay, now tell me the functions of all these. Out of C1 to C9, there are C1 to C9, there are many, no? Just a second. Out of all these, tell me the function. Who is doing the opsonization? Opsonization is done by 3B. Who is doing the chemotaxis? Chemotaxis is done by 5A. And who is anaphylactic toxin? 5A, 3A, 4A. The most potent is 5A. So chemotaxis and anaphylactic toxin both are done by 5A. Here also 5A, here also 5A. And here opsonization is done by 3B. Opsonization is done by 3B. Cytolysis is C5 to C9. No? They cause the rupture of the cell. Okay. So this is how you have to learn the functions. After learning the functions, deficiencies, you can see this is the diseases caused by their deficiency. If C1, C2, C3, C4 are deficient, this is known as early complement. 1, 2, 3, 4. Out of 9, the first 4 are absent or deficient. So the person will have SLE. The person will have glomerulonephritis, or the person will have frequent pyogenic infection. Okay, this is known as early deficiency. Okay, if late deficiency, have I mentioned? It is not mentioned here. If properdin or factor D is absent, so alternate pathway will not activate and the person will have Neisseria infection, frequent Neisseria infection. If C5 to C9 is absent, okay, that is late deficiency, late complement deficiency. Again, disseminated Neisseria infection, it's a PYQ in last year of NEET PG. You have to learn that. Okay, so you have to learn these factors, the deficiencies. Okay, can we go ahead? So let's revise it quickly. Can we revise it? The 3 pathways. You tell me the initiator, the trigger of all 3. The trigger. So here the trigger is antigen-antibody complex in classical pathway. In lectin pathway, the trigger is mannose sugar present in the cell wall of certain bacteria. And in alternate pathway, the trigger is endotoxin. Either you say endotoxin or you say cancer cell. Tell me the first complement in each, the activated in each of them. Here it's C1. Here it's directly C4 without C1 and here it's C3. Okay, tell me the convergence of all 3. The convergence is C5. That is also a question. Tell me the C3 convertase and all. What is the C3 convertase? Here 4B, 2A. Here also 4B, 2A. And here 3B, BB. Tell me the C5 convertase. Don't learn it. Just add 3B, 3B, 3B in that. You will get the C5 convertase. Here the complement, all level will fall. Here C1 is normal, except C1, remaining all will fall. Okay, here C1, C2 and C4 is normal and remaining all will fall. This is the summary. You get many questions out of that. Okay, you already know the biosynthesis. We have revised the biosynthesis. In the intestine, C1 is synthesized. In the macrophage, the multiples of 2, C2 and C4 is synthesized. In the liver, the multiples of C3 are synthesized, C3, C6, C9. In the spleen, the remaining 2, 5 and 8 are synthesized and unknown is C7. This is how I learned and I never forget. And effects, you know, opsonization is done by 3B. Chemotaxis and anaphylactic toxin both are done by 5A. You get questions on that. And cytolysis, we all know 5 to 9. This is done by cytolysis. Okay, so we are done. We will solve certain MCQs and I want all of you to answer it here. Please write down your answer in the chat box right now. C3 convertase in alternate pathway. Please read my question very carefully. I'm asking C3 convertase in alternate pathway. Your options are 4B, 2A, 3B, 3B, BB or 3A. What is your correct answer from ABCD? What is the correct answer from ABCD? Can you tell me the correct answer out of ABCD? Say something. What is the correct answer? Write down. I'm waiting. Yes, absolutely right, Mohammed. What about others? I want everyone to write your answer in the chat box right now. Yes, absolutely right, Meghna. Absolutely right. So correct answer is 3. So I'm asking the C3 convertase in alternate pathway. It's 3BBB. You can see it's 3BBB. C3 convertase. Let me change the question. Okay, the correct answer here is C and you all are right. Let me change. Instead of alternate pathway, if I ask classical pathway, or I ask Lectin pathway or Mannose pathway, what is your answer from ABCD now? Change your answer. Can you change your answer? The options are same. From ABCD, what is your answer now? I'm changing the pathway. What is your answer in that case? Yes, in that case, your answer will become A. It will be 4B2A. 4B2A will be a C3 convertase in classical pathway as well as lectin, because classical and lectin are exactly same. Okay, so correct answer here is A in that case and absolutely right. So you get questions on that. Okay, read the next question and tell me the answer. Tell me the total number of complement factors in the complement system. Tell me the total number of complement factors in complement system. Is it 7, 9, 13 or 20? Very easy question. We know C1 to C9. So correct answer is 9. Total are 9. Okay, C1 to C9. Total are 9. We know that. The next question. Tell me the complement which is formed in liver. Is it C2, C4, C3, C6, C9, C5, C8 or C1? You get confusing questions. So how I learn na? Liver may multiple of 3. We get multiples of 3. Multiples of 3 in liver and multiples of 2 we present in macrophage. Okay, so correct answer here is C3, C6, C9 and you all are right. In the liver, multiples of 3 are synthesized. If I change the question, instead of liver, I say macrophage, it will be multiple of 2. So answer will be C2, C4. And if I say the intestine, answer will be multiple of 1. And if I say spleen, it's C5 and C8. And C7 is unknown. So you get questions on that. Okay, the next question in front of you, tell me the activator or the trigger. The trigger, activator means trigger of the alternate pathway. Alternate pathway. Okay. So it's not antigen-antibody complex. It's the trigger in classical pathway. It's not Mannose-binding lectin. It's the trigger in the Mannose-binding lectin pathway. It's the microbial surface polysaccharide. Lipopolysaccharide is the other name of the endotoxin. So instead of writing endotoxin, they are telling you lipopolysaccharide. Lipopolysaccharide is endotoxin only. So correct answer is C. It's a little bit tricky question. So correct answer is microbial surface polysaccharide. I mean to say endotoxin. It is the other name given to endotoxin. So endotoxin is the trigger here. If I change the question to classical, what is your answer in that case from the same 4 options? Classical mein kya hai trigger? It's antigen-antibody complex. If I change the question to lectin pathway, in lectin pathway, the trigger is mannose sugar present in the cell wall. In that case, answer will be B. So triggers are very important, people. You get frequently questions on the trigger. The next question is in front of you. Tell me which complement is involved in both classical and alternate. Tell me, I told you 3, no, it's a tricky question. I told you 3 pathways. Classical, lectin or mannose, and the third one is alternate. I told you very clearly, in classical, all are involved. All 9, C1 to C9, they all are involved. In lectin, except C1. C1 is not involved. C2 to C9 is involved. In alternate, C1, C2 and C4 are not involved. C1, C2 and C4. Remaining all are involved. Kon bach gaye? Remaining all. Which all? C1 is not there, C2 is not there. So C3 is there, C4 is not there. C5 to C9 is there. Now tell me what they are asking. Now read your question. What they are asking a common in classical and alternate. What is common? What is common? C1 is there. C1 is there, but not here. C2 is there. C2 is here, but not here. है ना? C4 is here, but not here. So only C3 is common. C3 is here. Here all are there, but here also we have C3. So C3 is the common thing. So correct answer is C. I hope you are getting it. I hope you are getting it. Hello. So this is how you get tricky question. You can answer all if you know this. This is the summary. This is the gist. How many of you got it? Huh? The next question. Which of the following is true for C4B2A? What is C4B2A? First you decide, is it C3 convertase or C5 convertase? First you decide. And whatever it is it in classical pathway or alternate pathway? You decide. Huh? Is it C3 convertase or C5 convertase? I'm asking for C4B2A. So it is C3 convertase. It is not a C5 convertase. So remove these two options. C3 convertase of which pathway? It's classical pathway, not alternate. So correct answer is A, and this is how we approach. So C3 convertase in classical pathway. If I change the question to 3BBB, what is the answer now? Again, it's C3 convertase, but this time it is a C3 convertase of alternate pathway. If I change to again 3B, it will become C5 convertase of the alternate pathway. And if I change it to 4B, 2A and 3B, so again it will be C5 convertase of classical. So you get 4 questions, people. C3, C5, classical, alternate. Learn all 4. Learn all 4 at the tip of your tongue. If you can understand the complete cascade, it's good, it's best. But if you can't learn, it's okay. Learn the C3 and C5 convertase. You can't afford missing that. You can't afford. The next one question, tell me the function. Which of the following is the chemoattractant? Which of the following? Is it C5A, C1, C3 or C2? I told you the functions now. Chemoattraction is done by C5A. Anaphylactoxin is also done by C5A. So correct answer is C5A. But if I change the question to opsonization, it is C3B. In that case, answer will become C3B. So you have to learn the functions, especially the first 3 functions I told you. Learn opsonization, chemotaxis and anaphylactoxis. You get questions on these. These. Got it? Say yes. Now, if you want the notes, after the session will end, once I will end the session, after that, the notes will be there in the link in the chat box only. In the chat box where you are watching it right now on the YouTube. In the chat box, there will be a link. I will pin that link. And if you click on that link, you will get the notes. Not only of this lecture, you will get the notes of all my YouTube lecture. And that's totally free. You don't have to do any payment for that. So the notes are free of cost. Okay, so you can get the notes there. Okay, the session is completed. Now, if you like the session, don't forget to click on the like button. Share with all your friends, colleagues, batchmates, rather share with all medicos throughout the globe. Wherever there is a medico and want to study the pathology, microbiology with super simplicity, please share my YouTube channel link with all those. I will be grateful to you and it will be a big help for me. So requesting all, because it's a free education we are delivering, we want to benefit maximum medicos in the world. Okay, so please share the link of the lectures as well as YouTube channel to all your friends, colleagues, and suggest them to they can watch the simplified lectures there on this channel. There is a QR code. You can scan it. By scanning it, you will reach on the website, that's MedLive by Dr. Priyanka, and you can connect with me on various social media platforms like Instagram, like Telegram, like WhatsApp, right? And there daily I share small educational reels that will be super important for your preparations. Whatever exam you are targeting, you are medico, you are targeting some or the other exam. So it will be super simplified reels and you will get benefit out of that. Now there is a contact number. Either use this number or you can use this number it's 9833032948. Use this number and you can connect with me. So I'm available on WhatsApp also, on Telegram also by this number. So kindly note down the number, and if you have any query, whatever I'm teaching you, you can ask your query there. And if you have any topic in your mind, you want me to take that topic on the YouTube live, we can schedule it. You have to text it. Don't call. Please don't call. Text it. It's for chat support only. Text here, either on WhatsApp or SMS or Telegram. You can text and we will respond, and we will get that topic scheduled soon if many students are requesting the same topic. Okay, thank you so much. Every Tuesday and Friday, we take free sessions on the YouTube at 9:30 a.m. in the morning. Okay, so wait for the next turn. So today we have completed the complement system. The next on 26th Jan, I'm taking the transplant immunology. Again, a common topic of patho and micro. Transplant immunology, it's complicated topic and students always get confused in that. So we have scheduled that topic on the demand, huge demand of students. And the next is the chronic inflammation granuloma formation. Again, a common topic in the micro and patho. Okay, so tuberculosis, everything will be discussed here. The chronic inflammation, the granuloma formation, the steps, the examples, everything. So this is the next schedule I told you. Okay, got it. So link is not opening. Okay, Mistu, let me see. If the link is not opening, I will work. My technical team will work on that. Thank you for telling me. Okay, so I will work and I will get it rectified today only. Thank you so much for your time, for your patience. Thank you so much. Wishing you all the best. And I'm just ending the session. Bye bye.